Hello and welcome to the annual Medicare for All Strategy Conference. Thank you for joining us today to talk about the movement for Medicare for All in Massachusetts. My name is Stephanie Nakajima. I'm the Executive Director of MassCare, the Massachusetts Campaign for Single Payer, and I got involved in single payer work over a decade ago because for many years in my 20s, I had a pre-existing condition and did not have access to healthcare or the inhalers that I needed for my asthma.
And hi, I'm Katharine Nash. I'm the co-chair of the Healthcare Working Group at Boston DSA and a district leader for the MassCare Medicare for All Ballot initiative. And I got interested in Medicare for All organizing because as a dietitian at a hospital, I've seen the issues that lack of access to health insurance has provided for patients in this state and around the country.
Yay. Thank you for joining me today, Katharine. I work closely with Katharine at many points during the month, and I'm just really happy that you could be here today to talk about this campaign. So before we jump into that current campaign work, just a quick intro to MassCare. We are a coalition of unions, community groups, provider groups, and also individual members formed as a statewide campaign to coordinate action and organizing across the Commonwealth, state of Massachusetts, for single-payer healthcare. And today we're one of the few states that has paid staff to do Medicare for All work, one paid staff, and I actually work just part-time, but it has enabled us to carry out a sort of exciting campaign, and that we'll get to in just a second. But first, let me give you just a quick overview of where we are, where the fight for healthcare in Massachusetts is. All right, Katharine, can you see this?
I can see it.
Okay, good. Now, how do I move them? Oh, God. Let's see. Okay. Next slide. Okay. Yeah. So does Massachusetts have universal health care? This is something I hear a lot. Massachusetts already has universal health care. It was the first state that did Romney Care or the ACA, Obamacare, right? But actually, healthcare in Massachusetts is highly inequitable, even if most people in the state have what you could consider health insurance. I think right now, currently 3% of the population still doesn't have insurance, which is also just on its own a reason to have a Medicare for All system. But among those who do have insurance, 21% of low-income families, for example, have difficulty paying for medical bills compared to 12% of high-income families. So you're seeing really an inequity there. And then of middle-class families, so this isn't something that just affects people with lower incomes, but middle-class families in Massachusetts with employer insurance devote more than a quarter of all income to healthcare. And if you know anything about Massachusetts, housing costs are also exorbitantly high here. And so when you think about lower income and middle class families paying, maybe 50% of their income for housing and then maybe another quarter for healthcare, there's really not a lot left over for anything else. And of course, when you have a cost barrier to care that results in serious health issues and sometimes even resulting in death, of course, disproportionately for people of color. So in Massachusetts, the state of Massachusetts, which allegedly has universal health care, 31% of lower income adults went without necessary care or chose not to fill a prescription due to cost, and that was 2019. And again, all these statistics are from the 2021 report on Commonwealth report. The rate of mortality amenable to healthcare is 54% higher in the Black population and in the white population in Massachusetts. So what this means essentially is that there's actually, I think, 8 or 9% of all deaths in Massachusetts. And what mortality amenable to healthcare means is that these deaths would not have occurred if there had been, if the patient had had access to timely medical intervention. So that's 9% of all deaths in Massachusetts could have been prevented by healthcare. And of those deaths, they are disproportionately hitting Black and brown communities. And what is happening with all this money that really should be going to healthcare? Well, essentially our health insurers, even if they're quote nonprofits, are just sitting on tons of money, sending it either to offshore tax accounts in the Cayman Islands, or simply, stocking it away, piling it away, and not putting it back into healthcare, or rewarding their CEOs with exorbitant compensation. So what are we going to do about this? Well, we have a bill in the State House, both in the House and the Senate, an act establishing Medicare for All in Massachusetts, which would establish a Medicare for All program here in Massachusetts. And this bill actually has the support of 40% of the legislature. So, we're sort of trying to catch up with New York and California, who have already sort of crossed the threshold of majority support in their legislatures. And we are hopefully not far behind at 40%, and hopefully within the next session actually hitting that 50% benchmark. And this is what it looks like in the House. And this is sort of the darker districts you see here are the co-sponsoring districts, and this is what it looks like in the Senate. So let me stop my screen share. I just wanted to give it back to you, Katharine, at this point. So what is it going to take for us to win Medicare for All in Massachusetts?
Yeah, so it's definitely a big fight, but it's a fight worth having. So one of the things that we really need to focus on right now is getting more legislators to co-sponsor the bill. So like you were just saying, we have 40% of the State House on the bill right now, but we still want to catch up to California and New York and get a majority support there. That means that we need to get constituents to hold their legislators accountable to sign on to this bill and then support the bill as well.
Yeah, exactly. And whenever you're sort of, when you're looking at, getting more and more of a percentage, we're seeing this in Congress as well. Sometimes the low-hanging fruit, the really progressive legislators, AOC and the squad and everybody, they're already on, right? And so the last remaining legislators are harder and harder. But actually in Massachusetts, that is, of course, true to some extent, but there is a widespread support for Medicare for All in Massachusetts. And so actually a lot of the yet to co-sponsor districts really have just been yet to be organized around Medicare for All. And so, education is one piece, but simply just organizing people within those districts is sort of another thing. And you're the chair of the healthcare working group at Boston DSA, which I'm also a member, and is actually where we met and started our camaraderie. What is the word I'm looking for?
Comrade. No, I can never say it. Comrade relationship.
Comradely friendship / organized.
Yes.
And so tell me about how, your work there and how that sort of influences the way you look at Medicare for All.
Yeah. So, in the DSA and in the Boston DSA in general, we believe that healthcare is a human right. Everybody here deserves access to healthcare and should not be limited in terms of their financial access to healthcare. So we really believe that this change comes from the ground up. So we really need to build this mass political movement to get Medicare for All in Massachusetts. And that comes by connecting people across districts, across the state, reaching out to community groups, to labor groups, and continuing to build this power of people to force the legislators to take action and actually get this bill across.
Yeah, and the grassroots component, I think, really resonates with us at MassCare, that is the way we're going to win Medicare for All, is actually just getting out and organizing our communities. And it's not going to happen by any kind of politicking that we could do at the State House. Yeah, and so, when we think about how we're going to win Medicare for All, another thing, we don't only need to, get more legislators on, but the legislators that we have right now, their commitment to Medicare for All needs to be a bit deeper, I would say, in many cases. Katharine, you were on a Medicare for All forum that a state rep who is an earnest co-sponsor. And in fact, the state rep decided to put on a Medicare for All forum to educate his constituents, to talk about Medicare for All and what Medicare for All would do. He had MassCare on to speak, and he hosted this forum. How did that? What was revealed in that forum, would you say?
Yeah, so it was definitely interesting. It really demonstrated, I guess, the big takeaway to me was that there was a pretty significant knowledge gap in terms of the representatives' really knowledge around the bill. And that was pretty apparent by the questions that he asked at the end, just about Medicare for All and the bill in general. He asked a question about if there'll be private insurance under this bill. He asked, if you don't pay income tax, would you still be covered through the single payer system? So that was somewhat concerning as Medicare for All organizer, because this is, like you were saying, somebody who has co-sponsored the bill, is supportive enough of the bill to have a forum to discuss it with his constituents. So really my takeaway was that, I mean, one, there needs to be more education, even when we think, this legislator is good on the bill. We still need to continue to have these conversations with them. And it also goes to show that even if we do have a lot of co-sponsors, that doesn't necessarily mean that these are all like activist co-sponsors who will really be able to explain the bill to their constituents and to their colleagues at the state house, because they might still have some knowledge gaps around it.
Yeah, exactly right, Katharine. I have also been surprised talking to other legislators who are earnest co-sponsors of the bill. The questions they ask me show me that they haven't really read the bill, or they don't really understand what's going on. And if they don't really know how the bill works, then they're going to be very susceptible to arguments that are, of course, going to be made by industry, by opposing legislators, by everybody else, about why Medicare for All wouldn't work or why it's a bad idea, right? So sort of deepening that knowledge of existing co-sponsors is, of course, a really an important thing. And that also starts with grassroots organizing. So let's talk a little bit about the campaign we're running this year. Katharine, do you want me to share the slideshow again?
Oh, yeah, that would be great. Thanks, Stephanie.
Okay.
All right, great. So this year we're running non-binding ballot initiatives in all throughout Massachusetts. So a non-binding ballot initiative is a yes/no question presented on the ballot to voters in a specific district. So it's not a statewide ballot initiative. We do have to run them in specific districts. And it's really just a question asking, shall the representative in this district be instructed to vote for legislation that creates a single payer healthcare system? It is non-binding, which means that even if a majority of the district votes yes for this, that doesn't mean that we get Medicare for All. It doesn't mean that the legislator has to sign on to the district. It's really more of a tool to build the movement around this issue. So why a non-binding ballot initiative if it doesn't win us Medicare for All overnight? So it's really a tool to educate the district on Medicare for All and the potential to pass Medicare for All in the state. A lot of people, as you were saying, Stephanie, in the state are supportive of Medicare for All, but a lot don't know that there is a bill at the state level that we could pass to guarantee single payer here. It also lets constituents know that their representatives and their senators are not co-sponsors and helps them take action. So we're known in Massachusetts as a very progressive state. A lot of people are very supportive of Medicare for All. They assume that their Democratic representative in the state house would also be supportive, and they tend to be a little bit surprised when their senator isn't or the representative isn't.
Legislators love it when you go out and tell their constituents what they do and do not support. They love that. Get out there, do more of that.
Yes, I love it. Yep, we should heckle our legislators. We should put them on blast. Um, And then it also brings more people into our organizations and into the Medicare for All movement as well. Just being on the ground, talking to people. People are interested in continuing to organize around this if this is an issue that they find important. It's great to continue to build the movement that way. And then it also demonstrates that Medicare for All has wide support in the district, and we can bring that to the representative, to the senator. We can say, here, people in your district support this and they want you to pass this.
And they also all saw it on their ballot this November.
They all saw it on their ballot. They all know that you can do this.
Nowhere to hide.
Exactly. So the first step is to actually get the question on the ballot. So this is just simple signature collection. So we need to collect 200 signatures for representatives district. We need to collect 1,200 signatures for a senator's district. And then we double those numbers just for some leeway in case some signatures are thrown out. Then we submit those signatures to the city or town for certification, and then hopefully everything gets approved and the question will appear on the November 2022 ballot.
Woohoo.
Hey. And then part 2 is the exciting part. So that's really building power around this question and using this ballot to organize. So we'll be giving Medicare for All presentations to local community groups, political organizations. We'll canvass, do crowd canvassing, door knocking, candidate outreach, educational meetings to really talk to people about the nuts and bolts of this bill and what it would mean for the state and their district, and then do tabling, hand out lit, so that everybody has, a knowledge of what this is going into it and seeing that question on the ballot.
Yeah, I think this inoculation work is so important when you think about a lie that they're going to throw at us, and when we're actually close to passing Medicare for All. And I think it's just so essential that we reach everybody with, everybody in the districts that is going to be having a say in whether or not this gets passed or not, preemptively with sort of challenges to Medicare for All and the answers to those challenges. I'm sorry to your presentation, by the way.
Oh, no.
That's a know-it-all.
Thank you. I appreciate, you've been organizing around this for a very long time, so I appreciate any knowledge too and insight that you have. So please interrupt. But this is our general ballot timeline. So right now we're in the first phase of our campaign. So January to March, we're just starting to recruit signature collectors, setting up shifts for signature collecting, reaching out to other organizations in those districts, creating lit so that we're ready to go when we actually get those signature sheets. April 22nd, we can pick up those sheets to get signatures, and then we just start collecting signatures through crowd canvassing and door knocking, and then we submit to the state. July to November, that's when we really start to campaign for that yes vote on the ballot. We make sure that everybody knows what this question is, what Medicare for All is, so that they're ready to vote yes and feel comfortable with that. And then, yeah. And then hopefully we get a yes. And then November to December, this is when we can also start to follow up with legislators about the initiative and get them to co-sponsor with this pretty significant push saying, the majority of your district supports this. You should probably do what they say if you want to keep your seat, but in a nicer way.
Or not, really.
Or not.
It's time. It's time for Medicare for All. We've been nice.
Yeah. So Stephanie, I'm running one of the districts, but how many districts do we have so far that we're running?
So far we have 18 representative districts and 1 Senate district. That's the ambitious district that our dear leader, Katharine, has taken. So 19 in total so far. So 5 in the western part of the state, which is actually fairly progressive with pockets of not so progressive. And then 3 in the South Shore, Southeast area, which is kind of the same, and then 10 in Eastern Mass, so a lot of Boston and Greater Boston. For us, the weak areas are the central part of the state, and then also the North Shore, where we just don't have a lot of organizing. But it's good for us to do this as a kind of stress test to see where we have organization, and where we need to start building organization, because of course we need to have a true statewide campaign if we're ever actually going to put it on the ballot for real and pass it or get it through the legislature. So our next campaign, this is going to inform our next campaign. What areas will we likely prioritize next time?
Awesome. And how's the campaign structured?
Right. So this was a little bit complicated for us to figure out. And honestly, just 100% honestly, we are just trying it out and seeing if it works. And at the end, I will tell you if it worked or not. But we've created a structure. So you need a district leader for each district. This person is going to bottom line the canvases, hand out the ballot signature sheets, collect them. When they're done, bring them to the clerk's office for certification, just sort of like see the whole campaign through from beginning to end. If you don't have a district leader in your district or in each district you want, you're either not going to be able to execute the campaign. It's going to fall through in that district. Or if you want to do it, like if I wanted to do all this myself, I will totally burn out, which is not a sustainable thing for organizers to do. And we absolutely don't want to burn out organizers. And we really do need a leadership, I think, in this movement to take on more. So part of this campaign is actually just to develop leaders, which, our movement really does desperately need to carry out this work and all the work we will have ahead in finally carrying Medicare for All across the finish line. So the more leaders who are trained in organizing, committed, willing to put in the time, the greater the capacity you have and the more chance you will have of a successful campaign. So we have that district leader, and then we've asked each district leader to recruit at least 4 other people who will commit to canvassing for signatures. So once you have, and that's just also sort of like a mini stress test for each district. If you don't have that number at least, then you may not be able to actually get on the ballot, right? So district leader takes responsibility and then also takes responsibility for finding 4 other people to be part of the signature canvassing campaign. And then, so that's like the kind of the first part. And then all those signature collectors and the district leader, after they get on the ballot, will then move into the sort of campaigning for the yes vote in the second phase, which is going to involve reaching out to groups and all the stuff that you talked about in the presentation. So, let's talk a little bit about your district, which is sort of an interesting district because it's the only Senate district we're doing. Like you just went through, you need 200 signatures or 400 to be safe for a rep district, but for a Senate district, you actually need quite a bit more. You need 1,200 signatures, so maybe to be safe, 2,400 signatures. So tell us a little bit about this district, about Cindy Freedman, why we chose to do it, and what are the challenges and tactics that we're going to use in this district.
Yeah. So this definitely is a challenging district just in terms of geography. We do have to collect a lot of signatures for that Senate district, but I'm really excited about this district. Cindy Freedman is the chair of the Healthcare Financing Committee at the Massachusetts State House, and that is the committee where this Medicare for All bill is heard. So if we push her and if she is supportive of this bill, she's a very significant influence in actually making sure that this bill gets out of committee and gets to the floor for a vote. So she is definitely a person that we want to target. So I think it's definitely worth taking on this challenge. While it is a large district, we have to collect a lot of signatures. One of the other challenges with this district too is that in terms of Cindy Freedman, she is not a co-sponsor of this bill, and she at this time is not supportive of Medicare for all. Some of her constituents met with her recently to discuss her signing on to the bill, and she was not receptive. She had issues that she thought that this would lead to rationing of healthcare. So I think that, we definitely need to push her a lot on this issue to really get her across the finish line. But that's why really we're reaching out to constituents at this point and starting to really build the movement in her district. It is a fairly progressive district. It has Lexington and Arlington, which are fairly progressive suburbs in the greater Boston area. So there does seem to be wide support in her district for Medicare for all. Speaking with her constituents as well, they seem very supportive of this issue and are genuinely surprised when we say that their senator doesn't support this. So it really comes from reaching out to community groups, political organizations, political town committees, in this district to really start our organization or organizing in her district. And we've already started to get some people interested in giving presentations to their groups. And we've gotten some people to commit to collecting signatures as well. But yeah, it's a wide amount of space and she's not super receptive, but we definitely have some good inroads.
Yeah. And thinking about collecting signatures in such a large area, her district covers a couple different towns. It's going to be totally different from a rep district. You're going to, and I really appreciate like the way that you've sort of set it up. So we're going to have like a canvas in Arlington and then another one in the next town over. And we're going to be, actually trying to get signatures from a good sort of cross section of the district and not just going to like the one progressive area and trying to get all the signatures there, because this is not just also about collecting signatures. It's also about doing the real base building and education throughout the district so that we really do have support from all corners. So thank you so much, Katharine, for sharing what you're doing in the Freedman district and for being on this call with me today and talking about the campaign. I just want to leave everybody, let's see if I can share my screen one more time. So this is how you would join MassCare, masscare.org, if you just want to get updates on what we're doing. If you're in Massachusetts, then you can join this campaign. If you go to masscare.org, it's right at the top is like a sort of a link to the campaign page where you can read more about it and sign up. And of course, another action that we always ask people to take is to meet with their state representatives and to ask them to co-sponsor the legislation and for their continued leadership on the legislation. So, all right, well, thank you, everybody, and have a great time at the rest of the conference.
Thanks so much.